Hi everybody, it's just Bob here, Beach Baby Bob. Today I'm in Ottawa, the capital city of Canada, and I'm just finished my workout at the YMCA downtown Ottawa. Today I did some swimming and then I worked on my core muscles. And I wanted to talk to you a little bit about one of those core muscles. But before I do that, I'm going to ask you a question and I want you to answer me. So here's the question. What are your four main core muscles deep inside your body, close to your spine, that help you with balance and prevent you from falling over if they're in good shape? What are the four main ones? So I'll give you a few seconds to answer me. Right, you got that one. And then number 2, 3, 4. Not bad, not bad. Now, most people, when I ask them that question, they have no clue. They know that they have to work their core muscles so they have good balance and they don't want to fall over when there's maybe an accident, or maybe when they get older and their bones and muscles start to deteriorate, they're more likely to fall over. And if they had good core muscles, they might not hurt themselves quite as badly. So anyway, there's of course the multifidus core muscles that run up your spine from your legs through your glutes. They prevent you from falling over front and back. Multifidus. That's a mouthful, right? And then there's your transverse abdominis. Yeah, they run around the middle of your body like a girdle, are close to your spine, and they prevent you from falling over from side to side. So those are transverse abdominis, not your ab muscles. Those are rectus abdominis muscles. Those are surface muscles. But your transverse, crossways abdominis muscles, they are very close to your spine and they prevent you from falling over from side to side. And then of course we've got the famous diaphragm that moves inside your abdomen and it goes up and down as you breathe. And a lot of people who are not in very good shape, they don't move very much, and they maybe eat too much and they're overweight, maybe they smoke and drink, so they don't have much energy. Anyway, they do very shallow breathing most of the time. So they don't breathe in through their nose and blow out through their nose. They breathe in through their mouth and blow out through their mouth, and it's not very good for you. But that's because they can't help it, because they're just not in good shape. So when you breathe shallowly, your diaphragm moves up and down below your rib cage, and it's not doing much for you. It's not giving you much energy in your muscles and your connective tissues and your ligaments and tendons, so things aren't going well. So the best way to learn how to use that core muscle, that diaphragm, is to maybe go to a yoga class and somebody there will teach you how to breathe properly. Because you want to be breathing properly all the time, and especially in times of stress. It'll help you get lots of oxygen to your heart and things will work better. But today I really wanted to talk about the fourth one. Those are the kegel muscles. K-E-G-E-L. The kegel muscles in your pelvic floor. Yeah, these are probably the most important core muscles that I can think of. And I hear people in the YMCA there, in the fitness classes, and the instructors, the personal trainers, talking about core muscles and your pelvic floor muscles. Well, there are many pelvic floor muscles, and there are kegel muscles inside that group of pelvic floor muscles, kegel muscles. But let me just talk a little bit about your pelvic floor. So you have from your bone at the front of your body down below your belly button, And then that bone there has muscles that are kind of like a hammock, and they're connected to your tailbone up to your pubic bone, the bone at the front below your belly button. A little hammock going on there, and that hammock is your pelvic floor, and it's filled with great muscles, including your kegel muscles. Anyway, what's the job of your hammock or your pelvic floor muscles? To hold all the organs inside your body. So the pelvic floor hammock is muscles that are holding all those organs in place. And inside your pelvic floor muscles are your kegel muscles. Yes. Now, think of it this way. You've got a bladder in there near the front of your body, inside your abdomen, and it's filled with urine. And that urine has to get out of your body somehow, whether you're a male or a female. So there's a tube that goes from your bladder out of your body. And that tube, called the urethra, urethra, U-U-R-E-T-H-R-A, urethra. And that tube carries the pee, the urine, from your bladder out of your body, male or female. And so you can hold them tight, and then the pee won't come out because maybe you're not close to a washroom, or you're not ready. Or you can use the muscles, contract and expand, or relax, contract, relax, to get that urine out of your bladder. Of course, you have muscles in your bladder too, but the kegel muscles are the ones that really pull the urine out of your body. And also, in a male body, we have sperm produced in our testes. And that sperm is trying to meet up with the eggs in the female. So it has to get out of the body too. And wouldn't you know it, you've got a passageway through some tubes that sort of come very close to your bladder. I think they're called vas deferens, these tubes, but it doesn't matter. Anyway, the sperm are traveling through these tubes, and they're trying to get outside of the body, and of course they're coming out that penis too. The pee better just hold on for a few minutes because the sperm are on their way. And there is a little tiny walnut-shaped gland below your bladder, sort of really close to your urethra, and it's called your prostate gland if you're a man. And that prostate gland produces semen that helps the sperm wash out of your body. So that prostate gland is very important too. You need semen if you're a boy. If you don't work those kegel muscles, if you don't squeeze them and try to hold them tight in your pelvis area, every day you work out, that kegel muscle is going to just give up and not work. And when it doesn't work, then your prostate gland and your semen and your sperm are not going to be happy. And then what? Well, you'll have all kinds of urinary tract infections. You won't be able to ejaculate. You won't be able to get anybody pregnant. You won't be having much fun when it comes to the sexual intercourse thing if you're a boy or a man. So you need to keep that prostate gland, which is a little walnut-shaped gland very close to your urethra. You need to keep it healthy. And the way to do that is by working those kegel muscles, because you want to keep moving everything in there. So how do you do that? Work the kegel muscles. And I can sit here in the car waiting for my wife to come out from the pool, and I can work my kegel muscles, and I don't even have to be standing up. I can lie down to work them. All I do is squeeze my pelvic floor muscles. Yep, that tube inside my penis. I just squeeze it. I'm not using my hands or anything. I'm just using the muscles in my pelvic floor, the kegel muscles, to get tight and then relax, get tight and relax. So I can hold them tight, count to 10, let go. Do that about 10 times, 3 times a day, whenever you're waiting for somebody like I am, and you'll be getting good to go. Got it? So if you want to comment, hit the like button, subscribe to my channel, send me a comment and ask me questions. And remember, I'm not a doctor, but I am a fitness instructor, and I do a lot of research and go to a lot of workshops about health and fitness and wellness. So Beach Baby Bob signing off from the Capitol.